Good afternoon, Dr. Jha. I understand that some of the procedures that you do within the Renew Clinic is wart and verrucas. Can you just explain a little bit about what a wart or verruca is, what the difference between them is?
Well, verruca or warts are same, and these are illnesses caused by virus, HPV virus. And the victim of this virus could be adult or a child, and the children, they get verrucas on their fingers or toes. The adults can get on the fingers, hands or feet, or sole of the foot, and so on. So in lay terms, people call it verruca or warts, but they are different from genital warts. Genital warts are also caused by HPV virus, but there are certain strains, certain viruses strain which cause the genital warts. But in common terms, verruca and warts are same, and they are produced by HPV viruses. And interestingly, most of these warts or verrucas, they can vanish by itself without having to go through any treatment. And if they are left alone for several months, generally speaking less than 2 years, they disappear and vanish. But it does not happen all the time. Many times these verrucas gets bigger and bigger, and then there's concerns about the aesthetic appearance of their hands or fingers, or it may be under the sole of the feet, and it may be very painful to walk, because once they affect on a surface which is not a pressure area, they tend to be a lump, visible lump, and they tend to grow on the outside, outer surface. Whereas if the verruca was on the plantar surface, the sole of the foot, because the continued pressure, they don't grow outwards, they grow inwards. As a result of this, because the feet is very sensitive, so it gets very painful to walk and so on. And there is a special variety, what we call mosaic wart, which is there's several sites of the verruca occur on the sole of the foot, and they can be painful.
See, I remember when I was in my early teens having a verruca, and it was unlike the just below your toes. And I can remember having to go to see the nurse at the doctor's every week and having it literally cut out, which was painful. So what procedures do you do to deal with things like that that are completely different if somebody had got a verruca and had to go to their GP?
Yes, I'm aware that certain GPs or podiatrists, they have this verruca clinic, and what they do essentially do is to spray freezing liquid, which is liquid nitrogen spray, which is a standard treatment, but it takes good few sessions, sometimes as many as 10 sessions. And many times larger lesions may not respond very well, because with this spray, it damages only the top surface. And what about the underneath? It doesn't reach there. So it may not be successful for all verrucas. And therefore the clients may be trying other methods, such as what is available over the counter, or the GP sometimes prescribe topical treatment with substances like salicylic acid paint or TCA and stuff like that, which basically burns the top layer, but the verruca is still there. And we do get time to time clients who have got a painful verruca on the sole of the foot, or unsightly verruca on their hand and fingers. And the way we treat them, we vaporize these verrucas with CO2 laser.
Right.
And the studies have shown that the treatment with CO2 laser is more successful than any other methods. And we also give the clients a guarantee that if there is a recurrence, then they can have free of charge treatment once they have paid. And of course, we also aim that once we treat, say for example, plantar wart, which is on the sole of the foot, to restore the normal skin and normal skin crease of the sole of the foot. That's our target.
Right.
And if we haven't been able to restore the normal skin crease, the pink skin of the sole of the foot, then we have been messing around probably, and the treatment has been not effectively done. So our treatment aim is, or goal is, to restore the normal skin of the foot.
If they had more than one verruca on their foot, would you treat them all together, or would you do one first and then after each session then go on to the next one?
Yes, and many times we get clients who have got mosaic wart, and mosaic wart is in a small region. They have several clusters of warts, and we can treat all the cluster in one treatment rather than having to come each time for a different spot. Saves the time, and for us also it's easier to do that way. Now if they have multiple warts on the sole of the foot, there is a limitation how much local anesthetic we can inject at one time with regards to safety, and therefore we may not be able to do so many in one time. We may be able to do couple.
So on average, if somebody had just got one verruca on the sole of their foot, how many sessions would they need for it to be completely gone?
Good question. Generally speaking, just one treatment is required. They come to us, fill up some consent form, we'll explain them everything, and then straight to the laser room, and we vaporize these warts. And one treatment, we get most of these verrucas treated in one treatment. Very occasionally we may have to do 2 or 3, but that is very, very rare.
And do they need to come for follow-up afterwards?
Of course, I do tell them all that they have to have follow-up at 4 weeks, but sooner, maybe 5th day or 7th day, if there's a problem, we would like to see the patient.
And on a time scale of the procedure being done, how long does it take? So if somebody actually came in with a verruca on their foot or a wart on their finger, how long would they expect to be here?
Generally about an hour. We complete the procedure in an hour.
Okay. Thank you very much, Dr. Jha.
Thank you.